Welcome to beautiful Vienna, Austria's great capital and largest city. This year, Vital Options International took on its 6th year of the on-site coverage of the signature gathering, the essential ESMO ECCO Congress. The European Cancer Congress combined the efforts of the most important European oncology professionals with the aim of improving the prevention, diagnosis, treatment, and care of cancer patients.
Could you tell us a bit about the Esmo Initiative that is really going into the countries and looks what is actually accessible there?
Sure. I very briefly had 3 slides just to call your attention to a couple of points. And maybe I can help you also clarify your confusion, let's say. So in terms of disparities, there are many reasons to have disparities. Medicines is just one of them. So medication is just one of them. There are many other things that can lead to disparities. So for example, the access to the physicians and to the nurses, that's a very important barrier in many countries. So you can have the medication, but if you don't have the trained personnel to administer the medication, and the same applies to other types of treatment. You know, radiation is essential for certain types of cancer. If you don't have the machines and you don't have the trained health professionals, you cannot treat. So for example, one of the most common cancer, particularly in low-middle income countries, that is cervical cancer, that kills a lot of women. It's perfectly curable, but you need radiation. So not many people know that I was born in Africa. So my country is one of the largest in Africa and doesn't have one single radiation machine. Mm-hmm. So these are things that we need to think about, not just drugs. Yes, drugs are important, and I should not use the word drugs, but medicines are important, but it's not the only thing. Mm-hmm. Same thing with the experience of surgeons. So for example, I apologize for giving many examples related to women's health, but since you have here an expert in men's health.
If not a role model.
So for example, you know, we've been fighting in the breast world to have specialized treatment in breast units. Why? It's not just because we think it's very important. Also prostate units, we've been fighting. There are studies showing that if a woman is operated by a surgeon who does less than 5 or more than 50 cases a year, you have a huge difference in mortality. More than any other medicine can provide. So experience is fundamental. And so the health system infrastructure, the way that the patients can actually have access to what is available is crucial. So medication is one of them, but ESMO decided, because for cancer is of course indispensable, we can still cure some cancers only with local regional therapy, which is surgery and radiation, but most cancers need some form of medication. What we did was we took we did a survey on the reality. So we surveyed the countries, and of course there are 2 limitations of this survey. First, it depends on who replied, right? And how knowledgeable that person is of the reality of the country. And sometimes the reality in the country is very different from region to region. We may have the reality of one region of Spain and not the reality of the whole country, for example. And also, it's a snapshot, so it's at that moment. Things are evolving, fortunately, and drugs are being approved in different countries. What we did, and you can find all the results are published, and you can easily find them in the ESMO website if you go under patients, also under policy, so you can find it. So what we saw is that despite the drugs are being approved at the central level, so at EMA level, then when you go into the country level, it's totally different, 28 or more different realities. And when you go inside each country, sometimes it's a 10 or 15 more different realities. In the UK, for example, if there was a situation where, I don't know about now, the fund, the special fund they have for medication, if it's finished or not, but before it was just a matter of 10 miles and you would get the drug or not. So this is really is against everything that we all believe about equality and in the availability and access. So if you go and see the results, we did it in a graphic way with green, blue, and red. And you will see that in many countries, despite being approved drugs, patients can only have access if they pay it fully. And this is particularly important for advanced cancers, which is something very that touched me personally, since I'm dedicated to advanced cancers. It's less so for early cancers. And why? And this maybe it's an important message for you to know, because when a cancer is diagnosed early, in the majority of them, but particularly the big killers, let's call them, they are the medicines that treat the patients, that achieve the highest rates of cure, are not the new medicines. So Bonadonna, you mentioned. Bonadonna invented a regimen called CMF. CMF saved millions of women's lives.
Could you clarify
CMF,
what it stands for?
Yes, it stands for cyclophosphamide, methotrexate, 5-FU. Very old drugs, and in the essential list they are there. Why? Because yes, so there are three drugs of chemotherapy, but they are very old drugs. But they can be used in so many types of cancer and in a huge number of patients, that they save so much lives. And that's what makes a criteria for it to be in the essential list. You see, because trastuzumab is also very important, but only 1 in 4 women would really benefit from receiving trastuzumab. CMF or whatever, other types of chemotherapy that are very common, it's for all of them almost.
Could you say that now, as we unfortunately don't have this slide, could you say what are the problematic regions in Europe?
Oh, unfortunately, I think we all know that the problematic regions is Eastern Europe. So the difference between Eastern and Western is very much seen. And you take any example of any drug and you will see the difference. And you can take the drugs, the medications that are in the essential list, not even to go to the newest ones. But then there are 2 factors that I would like to tell you. For example, and I don't know the solution for this, but in some of these countries where most patients have to pay the full cost of the drug, some other drugs that have less proven efficacy, for some reason, are reimbursed. So there is not a very coherent decision sometimes. And that's why you said, well, what about this new drug? Sometimes, I don't know why, maybe it's a very strong advocacy group in that area, in that country, and then you have that drug that for some reason is reimbursed, but then you don't have others that are much more important.